let's say a cortisone injection, you might say, well, you know what, I can't. I mean, do you have to say, well, I can't maybe massage or
that area?
Yeah, yeah.
That area.
Okay.
Yeah, there are a
So-
list of contraindications,
Yeah.
and there are a list of precautions.
Okay.
Same with somebody who comes, for instance, with high blood pressure.
Okay.
There are some precautions that we have to take. And then there are some times when you'll have to say, I'm sorry, you're going to need to go and see your doctor.
Yeah.
And ask your doctor if I can treat you.
So I'm thinking of from a patient point of view coming to a massage therapist. These are things they need to say, right? They need to
Yes.
advise the massage therapist that, I mean, not all of the massage therapists necessarily ask all of the questions. So they need to go prepared to say, look, I've had this or this has been done. Is that what you think should be the case? Or yeah.
Yes, and always be comfortable to ask your massage therapist about any question that you might have. Especially the first time you contact somebody. You know, you look in the yellow pages or you look online, you don't know one person from another. So always feel at ease to ask that person, what are your qualifications?
Yes.
And how long have you been doing this? What modalities do you practice? How many people do you see with fibromyalgia? Have you got experience? Have you done some research into that? So that you can feel comfortable going to see that person, that they're going to be looking after you at your best interest. In my practice, it's more fibromyalgia, but there are some people who have a combination.
Mm-hmm. Yeah, well, we see them often, unhealthily weddings between FM and CFS. Many people have bits of both, I think. Yeah.
The other thing too is the third component to that is that frequently people with fibromyalgia and chronic fatigue also have a lot of digestive issues, food sensitivities and irritable bowel kinds of issues.
Yeah.
Yeah. Now, do you? I mean, obviously, you're following patients for quite a long period of time. Do you see their illnesses progress into other things, like arthritis or things like that? I mean, typically, the medical profession would say no, they're not progressive illnesses. They don't move to other things. But what I've seen is people do develop other illnesses like arthritis, like rheumatoid arthritis and things like that. Now, maybe they would have developed them anyway, but I mean, do you see that in your patient groups, or do they tend to be pretty much focused around the fibromyalgia?
There is a correlation now that you mention it. Frequently, people who have fibromyalgia will talk about arthritis in certain joints of their body. Not so much of the rheumatoid RA, but a lot of people with the osteoarthritis in the bones, in the joints.
Yeah. Now, when people see you, do you ever talk to them about what kind of physical activity they do to keep their motility, keep their body's functions moving? I mean, it's a generally held belief with both FM and CFS that people do get pretty dysfunctional. They can't move about very much and they're reluctant to do exercise because of post-exercise malaise and things like that. I mean, do you help advise patients about these kind of things, what they possibly could do, what they could maybe think about doing and stuff like that?
Yes, and that's part and parcel of what a massage therapist is supposed to do too. We have rehabilitation exercises that we can help a person learn and monitor as well. If they've been told to do a certain exercise, we'll ask them show me how you're doing it, and are you having discomfort? Because it may be that they're going home and they're not doing it properly. And monitoring also the exercise to make sure that it's not overdoing it for them, but keeping them progressing to a point where, if they've been immobile, that they can actually progress to a more mobile state.
So what do you say to someone like me who comes to you and gets a relaxing massage and then rushes off to a meeting and gets all wound up again? I mean, my experiences are with a massage, it's better to go have a big glass of water and relax for a bit after it as well, because it seems to work better and the effects last longer. But if you get yourself right into something stressful straight after it seems to have wasted the point. What do you think? I mean,
well, then you're minimizing the effects of the massage to being just that time that you were on the table. Whereas if you're able to continue the day on a slower pace, like you said, go home and rest. drink a lot of water that day to make sure you're flushing out the toxins. If you don't have a blood pressure issue, go home and have a nice Epsom salts bath to help to flush out the toxins even more. Those kinds of things to help you continue the relaxation and keep you in that more homeostatic, static
because
state.
in this kind of really pressured world, people almost seem to need to be on the go, right? I think sometimes it's an affliction. But I meet lots of FM patients through the charity, and many of them still lead quite dynamic lives. And I think the slowing down process is a really vital part of balancing the dynamicism with the pain and the rest of things. And can you talk to the kind of that delicate balance between keeping yourself active and treating your body?
Funny you mention that, because it's an observation of mine with people who have fibromyalgia that they are people who give of themselves a lot. They are people who keep on going, people who have difficulty saying no. So it may even be something to practice as a person. If you know that you're the type of person who always gives and always goes, to make it a practice to say, today this is my limit. These are how many things I'm allowing myself to do, because I've got to keep myself in mind. And sometimes we discuss that.
Yeah, no, that's really good. So finally, from all of the experiences you have and the people you've met, just a few words of advice for people with FM, with CFS, with chronic pain, about coming to a massage therapist. Just to sum it up, how should they prepare themselves? What should they do after that? What should they tell you? What should they do following the massage therapy to get maximum benefit from this experience?
In order to get the maximum benefit, I've said it before, be totally comfortable asking your massage therapist or whoever you contact what their qualifications are, and make yourself comfortable. What you need to know, go ahead and ask it. Ask your friends, who do they know that is a good massage therapist? Keep your day lighter after you've had your massage. So when you're scheduling your appointment, don't schedule it at the beginning of a day when you've got 6 meetings afterward.
Okay.
If you've had 6 meetings, it may be a really great way to finish your day. So scheduling it that way. And then see to it that afterwards you've got some time to go and have a nice glass of water and relax. So that you can continue the effects of the massage. Do the rehabilitation exercises that your massage therapist recommends. Find some time, make it a point in your schedule, put it in there. You deserve it. And I think the most important thing I want to say is that this is your life. This is your health. So you're the one who makes the decisions.
Jeanette, thank you very much. I probably need a massage now after this. A very good job. Thank you very much.
Thank you.